Good afternoon, everyone, and welcome to this, our second in our events all about joy in work in the NHS. My name's Richard Taunt.
I'm Anne Howells.
And I'm Danny Ryan.
And we're delighted today to have Jessica Perlo with us from the Institute for Healthcare Improvement in the States, talking about all of the work which IHI have done in this topic for some time. So we do try and attract global experts to our webinars when we can, and we've certainly done that today. So I think we're going to have, over the next 58 minutes, a great discussion. But before we'll turn to Jessica in just a second. Why are we talking about joy in work? And why, as Kaleidoscope, is this something we're interested in? Well, I don't know about you, but I think we've probably had our fill of headlines, of stories, of talk about everything which is contributing to low morale and a bad place to work across the NHS. And we think possibly it's time to change the conversation. And actually, how can we start to think about where there is joy in work? What's happening there? Why is some places really great to work? And how can we have more of it across the NHS? And we say that not in the view that we should just forget all about the pressures and all the things which do make it difficult to work in the NHS, but actually we need to think about how, within that fairly hostile climate, we can carve out space for joy and work and give the time, space, the energy to focus on the things which we know matter but often get squeezed out. So very much looking forward to hearing from Jessica. Very much looking forward to hearing from you too. This is designed very much as a discussion and we'd love for you to join in. Anna, how can people join in?
Yeah, so because of the volume of people on the line, we're not going to be taking questions by voice, but there's 3 ways that you can join the conversation. Either using the question box facility, which should be on your screens, or via Twitter. We are at Kaleidoscope Health and hashtag is NHSjoy. Or you can email us hello@kaleidoscope.healthcare. And those last 2 options should be in your chat box now.
Excellent, good. So I think without further ado, Jessica, welcome. Thank you so much for being with us. And you're going to talk us through some slides.
Yeah, thank you for inviting me to be here. It's exciting to talk to you all, and I'm excited to hear the feedback from folks on the line. So really quickly, I'll just introduce myself. My name's Jessica Perlo. I'm a director at IHI. If you're not familiar with the Institute for Healthcare Improvement, we're a nonprofit in Boston, Massachusetts. We've been around 25 years now doing research, education, convening around improvement science and patient safety, costs of care, the health of communities. And so one of the arms of our work is focusing on the joy of the healthcare workforce. And so when I say joy, I mean the intellectual, behavioral, and emotional commitment that one feels to meaningful and satisfying work. So we were very deliberate about choosing this phrase, joy in work, even though we see people cringe sometimes when we say it. It's actually not a new phrase. It goes all the way back to Dr. Edward Deming, who expressed that improvement science is a means to experiencing joy in work. So in Deming's world, joy was the product of quality improvement and a function of high quality systems. And so the next slide should share a little bit more, trying to toggle back and forth. Yeah, this is the right time to be talking about joy in work because, just look at some of the data. There's the kind of a steady drumbeat of news and research these days about health professionals being burned out. Reports that show that burnout is twice as prevalent among physicians in the US as compared to other workers in other fields. In March of this year, or last year now, it showed burnout by role to be about 50%. So like half of all US physicians, 40% for clinical nurse managers, and maybe like 32% for licensed practical nurse and administrative clerks. So the burnout is becoming an epidemic. And there's also work to be done with regard to physical safety. So healthcare workforce injuries are 30 times greater than other industries. This is not exclusive to the US, unfortunately, as I'm sure you know. So the next slide shows this 2008 World Health Organization report that found turnover in health professions is largely due to these conditions of unsafe working conditions or insufficient resources, limited career opportunities, really kind of engagement issues. And according to Gallup, at any point over the last 15 years, only about 15% of our global workforce was or currently is truly engaged, and about 2/3 are checked out. So the next slide. Right, so this is also a triple aim issue that you can see here, that there's a good deal of data that's showing that joy in work is inextricably linked to patient outcomes. So this is not something that's purely about making sure our workforce is happy. It's actually affecting not just our bottom line with turnover, but also care. So the next slide. The only other thing I'll say, when we talk about joy, is we intentionally don't just talk about burnout, even though that's what most people are publishing and talking about. So while it's necessary to focus on burnout, it's not sufficient. So you'll see a lot of our framework is talking more about joy than it is about mitigating burnout. So we're talking about motivating and producing joy. So to create this framework that I'm going to walk you through, IHI led 3 90-day innovation projects on joy in work. We just did some concentrated research. We started in 2015, and the goal was designing and testing this framework for health systems to improve joy in work. So the first project was just kind of scanning current published literature on engagement and satisfaction and burnout. The second was doing, I think there were a little over 50 expert interviews, and these were with folks inside and outside of healthcare. So Starbucks and Zappos and health institutions who are also known to be more joyful, people who are on the cutting edge really of working to improve joy. And then we learned from them, created a change package that we then tested in our last cycle through prototype testing. So what you're seeing now is a result of that effort. And so these are the steps. So this is focusing on leaders, and that's why the model, and we wanted to give leaders steps to get to joy. And that's why this model looks like a staircase. And so the point of this is that each step would serve as a foundation for the step that follows. And these aren't overly complicated. In a lot of ways, they're intuitive. It's just, start by asking people what matters to them. Not a Q&A, but a Q&L. So asking and listening to uncover what matters to the people around you. Why do they care? What called them to this work? Really appreciative inquiry is helpful. My background is in community organizing, so I love doing public narrative and being able to tell your story of self and what called you to this work, and talking about values and shared interests as a way to engage one another in this. The next step is where leaders identify what's getting in the way of their good days. So what are the processes, issues, or circumstances that are impediments to what matters, or the pebbles in the shoes that are getting in the way? And in doing this, you oftentimes uncover things that need to be addressed first. And to us, we've prioritized barriers that kind of relate more closely to our innate human needs, things like physical and psychological safety, meaning and purpose, choice and autonomy, camaraderie. These are, like if you think of Maslow's hierarchy, these are the foundational things. And then step 3 is committing to a shared responsibility for removing these impediments. So you create partnerships, multidisciplinary when possible, and opportunities for people to come together and share responsibility for removing these impediments and for improving and sustaining joy. And then lastly, we encourage leaders and staff to use improvement science together to accelerate these improvement efforts and to help them determine if the changes that they're testing are actually leading to improvement, if they're effective in different settings with different professions, and if they're sustainable. So that's really the how of the framework. It's not meant to ignore the larger organizational issues that exist, things like the impact of the electronic health record functionality on your daily work, or workload, or staffing issues. Instead, it's just attempting to empower local teams to identify and address impediments that they can change. So it's trying to convert the conversation from, if only they would, do this, to, okay, well, what can we do today? So it's trying to change it from us to not just a them. And that's the intention of the work. And then the next slide, I won't walk through this whole thing because I know we're just keeping it kind of tight for time, but it walks through each of the components that I just spoke to with a little bit more of what's under. So senior leaders are responsible for everything, but this helps them to see what can core and unit level leaders do? What should individuals be more responsible for? And we think together, these are all critical for ensuring a joyful, engaged workforce. And you see, there's a very tiny sliver of this, very tiny sliver. I guess maybe it's a third, but that actually has to do with the individual. And that's intentional because the conversation has been so much when you talk about joy, people want to talk about wellness programs or, discounts for gym memberships, and that's great. We should be thinking about people's well-being and the whole person, but that's not it in and of itself. So the focus is on the system, it's on leaders, it's on empowering teams, and a part of that is how we equip our teams to be resilient and contribute to improvement efforts and feel empowered. So that's a lot in a little time, but I think. Did I keep it to 10 minutes?
I think you did pretty much spot on, Jessica. very much indeed. Jessica, really fantastic introduction. Thank you very much. Huge amount of food for thought there. Just to say, if you want to see any of the slides Jessica's been putting up, Anna's put the link to all of the IHI Join Workbox or Join work in the question box, so you can follow the links there. We'll leave that slide up just for a further second. So we'd love to get your feedback, questions, Jessica, reflections, links into your own work. Anna, how can people get involved?
Yeah, 3 ways to join, either using the question box that should be on your screens in front of you, by emailing us hello@kaleidoscope.healthcare, or on Twitter using hashtag NHSjoy at kscopehealth.
Excellent. Thank you very much indeed. So please do put things in. Danny, I'll come to you in 1 sec if that's okay, but I'm going to jump in there with a first question, if that's okay. Jessica, thanks again. You mentioned it in your talk, but also I think it's the first line of the white paper, that when you talk about joy in work, some people go, oh, that sounds a bit flaky. It doesn't sound like something proper to focus on. What's your experience of overcoming that skepticism? How do you convince people, even before they start to go through your steps, that this is something they want to address?
Yeah, I don't think I can really convince people that joy in work is important. I think they just know it. It's the right thing to do. And so focusing on the outcomes, if you need to, the business case for this work has been most effective. But using whatever language works for that setting is fine. We like joy in work because just like Aaron Antonovsky said that health is more than the absence of disease, joy is more than the absence of burnout. But people seem to be focused on burnout because there's the clearest link. There was a study that said it's about $1 million US dollars to replace one physician. So then you quickly get an ROI for this work. But we've heard sites say that they prefer kindness or well-being. The National Academy of Medicine uses whatever language is appetizing to your setting and doing the work that matters to your local teams.
Jessica, thanks very much. Artistically put. Danny.
Thanks very much for the insights. I really enjoyed the white paper as well. My question is, you used the term earlier, checked out, Jessica, and I just wanted to know, what does that mean and how do you measure it?
Sorry, can you repeat the first part of your question?
Yeah, sorry, you used the term checked out and you said 2/3 of people are checked out at work. So what does that mean and how do you measure it?
Yeah, so measuring checked outness, I don't know the answer to, and measuring joy is difficult. So at present, there's no single validated measure of joy in work. I saw an article maybe a week ago about a measure of joy but joy in work, it's difficult. So until there is, so we draw on other indicators that are known to contribute or signal trouble for joy in work. So we usually advise folks to focus on system level and local measures, a combination of the two. So 2 or 3 system level measures like satisfaction, engagement, burnout, turnover, retention, employee well-being, workplace injuries, absenteeism. These are usually reviewed annually at least, but they give you an opportunity to identify areas for improvement or at least track your progress over time. They're not enough for improvement efforts, right? Because you're only getting data points most of the time annually, at best maybe monthly. So local level measures or assessments that occur more frequently that local leaders can use for improvement on a daily or weekly basis are preferred or are a nice supplement to that. So these are usually initiated and tracked by the staff themselves or along with the core leader of the unit. So it really depends on the setting, but I could say so much about it. There's so many out there too that are great, and using what you have rather than reinventing the wheel usually is a good place to start.
Okay. And with this kind of dissatisfaction in the slides that you showed and things, you know, we always hear about this in the context of millennials, something that Rich and I missed out on, unfortunately, being a millennial. But they're dissatisfied. And my question really is, you know, are we just better now at thinking about joy at work, and maybe we're recognizing that dissatisfaction, or was there joy before and now it's gone?
Yeah, no, I think millennials and the workforce in general, the demand is changing, and there's some evidence to support that people are now looking to work for places that have a mission. Like, you can't just open a pizza joint. It has to be, you know, thinking about the environment. So there's a lot more consciousness about a direct line of sight between the work people are doing and the purpose of the work that there didn't used to be. But other than that, generationally, there hasn't been a ton of data to support there being a need for different interventions for different generations. And I don't know the answer to whether or not it's worse now than it was. I know people are measuring it more, and it does seem to be getting worse. There's been studies showing that burnout is getting worse. Yeah, I don't know if that answered your question.
It did. It was a difficult question, so don't worry. I don't think we're getting to the bottom of that today, are we? But
in a 1-hour webinar, we're going to try and cover how you improve the morale of the workforce and wider societal questions about millennials. And if anyone wants to chuck in anything else, or foreign policy questions, I'm sure we can deal with those too. Anna, I know comments are starting to come through on the text, but just one more for me before we go on. Jessica, there's a really nice part in your steps diagram about needing joy in work to become this shared responsibility, and I think the type of conversation which would go on about joy in work here, and this might resonate with people on the line, is that they say, right, okay, joy in work, that's an HR issue. Give that to the director of human resources, of workforce, and they can sort it out. And I'm just going to get on with my business. Thanks very much. Do you have any sort of particular practical sort of tips or ways you work with people to try and encourage that shared responsibility, rather than just shunting it over to the human resources department for some poor person to try and resolve themselves?
Yeah, I have seen Imperial actually address this really well. There was an HBR piece. It's not new. It's an old management article that I've referenced a lot that looks at what they call hygiene, just good hygiene for organizations. Those are the things that HR should be assuring. Salary, flexibility in your work hours, just the things that aren't going to produce or motivate behavior, but they're not going to produce burnout. So the things that promote behavior are very different from the things that create burnout. And what we're talking about is motivating an engaged workforce, not the kind of things that should be there anyway. I've had this challenge as well, and it's okay. I think a lot of times things are initiated by HR, and they're an important part of the team that is working to improve it. And I know internally we work very much the same way, where we partner with our HR team to come up with solutions. And then there's a bit about participative management and just what are the techniques for co-producing solutions, not just saying, here's what we're going to do, because so much of the conversation and the how of the work is actually what's important, not the intervention. So it's a lot about that dialogue and that space to say, I don't feel like I need to solve your problem. So I think sometimes people are afraid to even ask because then they feel the burden of responsibility to fix. And instead it's saying like, okay, well, what can we do together? Or admitting that we don't know the answer, but let's see, what can we do by next Tuesday together just to start to move things. So there's so much literature on participative management, and I'm no expert at all. So I think that's a good place to start in terms of learning.
Excellent, Jessica, thank you. And Anna, we've got comments coming through.
Yes, we have a comment from Yvonne. Thank you, Yvonne, who says, it's great to hear the focus on the system, leaders and teams, and that their work on emotional labour speaks to this, and that just organising mindfulness sessions for staff is not discharging the employer's responsibility to create the right environment for joy in work, and that this work is so important. So thank you.
Thank you.
Thank you very much. And just got a nice link there to the role of boards and leaders. Not wanting to put you on the spot, but would you say if an organisation wanted to develop sort of an approach to joy in work, but its leadership wasn't bought into it, is it going to work? Or is that leadership sort of first step?
Yeah, I hear that a lot. I don't want to say no, but it's so critically important that leadership gets it. And there's Mayo has some really great leadership assessments. They care. I'm sure that they do. It's just about engaging them with the right elevator pitch for the work that will engage them based on their values. But I will say it's really, really hard. And I've talked to a lot of people who are in situations on teams where they're really removed from maybe the senior leader, and their unit level manager doesn't even seem to really get it, or doesn't have the time, or there's conflict. That's where I really love community organizing and finding your people and finding your community, because I can't do it alone, and my energy is going to wax and wane. And so I need this other team to be like, no, we can do this when I can't, when I'm going to lose my steam or I have other commitments. And so that's been critical for me personally, is having, we have an internal improvement team. And sometimes I don't have the time to be, or the energy to be trying to drive something forward. But because we have a shared leadership model for our work, for our small team that's working together, that it continues to move forward. And the way I engaged that team was through one-to-ones. So instead of just sending out an email and saying, does everyone want to work on this with me? I just had conversations to say, first of all, why did you get into this? What is your work like? And here are what my values are. Here's what I care about and what I'd like to see. Oh, it looks like there's some overlap here. So it's really kind of an exploratory conversation. Can you commit? Asking for that commitment. Can you commit to work with me on this? Or having a conversation with one other person. So we built a distributed leadership model, and now we all come together, and I don't even schedule the meetings, and it's helpful. It doesn't quite get to fixing the entire system, but we've been able to escalate a few things up to our senior leaders that, we have consensus around. We're tracking data together. We have, and data doesn't have to be really formal. It can be a bunch of qualitative stuff themed into topics. And then we've bubbled that up and said, look, you have this problem, what do you want to do about it together? Derek, my CEO, has been extremely receptive to that. And I think it's an effective way to build your army.
Excellent, Jessica, thank you. I'm resisting with every fibre of my being not to talk about a Scot in charge of an organisation being one focusing on joy and the irony of that. I can say that being half Scottish myself, I'm not making any particular sweeping generalisation. But Jessica, great to hear about some of what IHI is doing. I'm going to turn to Danny in 1 second. But could you give us a particular example of an organisation you've worked with which has really taken this to heart, and sort of how they've got about that, and what they've managed to achieve?
Yes, I'm trying to pull up. Well, I don't know how to share this with you, but I'll share a couple of just lessons learned from the prototype testing. So Nemours Hospital. We had a pediatric intensive care unit here in Delaware. They wanted to anonymously identify challenges and frustrations in their current work. So they used a GUR board, like GUR, where they asked staff to report what the stones in their shoes were. And they got over 100 responses that they then categorized. That's my dog saying hi. They categorized into key areas for improvement, and it also gave like a renewed sense of purpose with staff. So it helped them to identify smaller quality improvement projects for future work, and then got them to that kind of step 4 of using improvement science. The University of Virginia, their School of Nursing team found that using this framework was more effective than a standard committee-driven process. So they knew that they had an issue from previous surveys with staff feeling less joyful, and so they met with them, tried to find out, what a little bit more detail, and then found out that they weren't feeling respected for their time off, that they weren't paid to be there. So they did a delaying of routine emails from the weekend to the following week. And it was so effective that one then got scaled to the entire school. And then they did some like post-intervention surveys that showed a lot more satisfaction from that particular group. Imperial College. So you had Bob Klaber on last webinar, so I'm not sure if he spoke to this, but he was part of sanctioning the team. They got all their stakeholders involved, and they used their team-based workshops to co-create better days. Did he talk at all about that?
No,
Not
no, tell us.
Yeah, what I love about Bob's approach too is that it's also really community organizing focused. But once they found their own definitions of a good day, that helped them to stay involved and engaged with the project and their colleagues. So they realized they didn't really know what made for a good day for their colleagues, and different for everyone. So they did speed dating, where they had 2 people ask each other what makes for a good day, and they were intentional about focusing on bright spots rather than challenges. And then they did ask what gets in the way of a good day. And then together they decided, okay, well, what could we tackle first? Where are the common themes? What could we change within a day or within our immediate team? And then in the end, they were able to discover the conditions and attitudes for a culture of safety. And then they worked with their QI team, right? Then they linked up with an existing quality improvement team to then test improvements and host workshops. They did a lot on social media. So they are a really cool place. But a lot of these stories are in the white paper change package. We kind of distilled them down, and then more of them will be uncovered. We're doing a virtual programming. I didn't even show that slide, the last slide. Yeah, this is intended to help guide individuals and teams through an improvement project to restore and improve joy. And so it's, like Don Berwick and Tejal Gandhi, Derek Feely, and I'm forgetting people, lots of different people teaching about what they know and why this is important to them. And then we'll come together through calls, 3 separate calls, and then there's added coaching if people need it. But it's an opportunity not just to learn from us, because everyone is an expert in their own joy, but to learn from each other. So hopefully it will give us an opportunity to raise up, if there's folks on the line who have really great interventions that they want to share, this is a vehicle to do that. So you can still sign up. There is a fee associated with it. And find out all of the different fee structures on the website. So IHI.org/joyandwork. And it doesn't start until March.
Excellent.
It's completely virtual. It's not in person. So you can join from anywhere.
Perfect. Jessica, thank you. Debbie.
On the webinar on Tuesday with Bob Clay, we had Helen Stokes-Lampard, who's the chair of our Royal College of General Practitioners. And one of the things that she said, her kind of key learning points were really about knowing yourself and knowing your own values and all that kind of, and that's kind of something that we don't often take time to do. And I'm probably now asking for insight into that digital program, but how can you encourage individuals to take that time to think about actually, what are my values? What do I want from this? Because we always talk about company values, don't we? And you go into buildings and it's emblazoned across the wall. But how can we start to look at ourselves a little bit more?
Love that question. So if you well, maybe you have as a group, looked at Marshall Gantz. So Marshall was a community organizer involved with civil rights in the US in the 60s, also involved with Cesar Chavez and the farm workers in California. So has a long history of organizing with unions and with disenfranchised groups of people. And he is a professor at Harvard Kennedy School in Boston. We worked with him and it's just changed the way I think about my own work. So he follows the structure of self, us, and now. And it's a whole framework for how do you uncover your values. And a lot of the ways we uncover our values are through our emotions, which people, especially in medicine, are really uncomfortable doing. But it's so critical that we talk about our values and our stories, because oftentimes in public leadership, if you don't tell your story, someone else will. And we saw this with our political election. We saw this in the US. I promise I would talk about Trump at some point in time. But say what you will about him, he was able to communicate his values in a way that commanded an outpouring of support that we weren't anticipating, that Clinton and his opponents weren't able to do. And this does have direct translations for healthcare. If we can't communicate our values and why we're there, we can't motivate other people. People don't know who we are to connect with us. And so it's so important that we do that. He has great frameworks to help you do that. Why David Sometimes Wins is his book. The IHI Open School has a course on community organizing that walks you through how to tell your story of self and how to coach other people in telling theirs. I hope that's helpful, but that's extremely exciting to me as a question.
It's a concept that we're not really, absolutely, like you say, we're not comfortable with it in medicine. And it's not a very British thing to do either, is it, to tell your story? But we could certainly explore that a little bit more.
Well, Jessica, I find that fascinating that you talk about Marshall Gantz and then Trump as. So I don't think he's running up on the line today, but we've got. Well, Jessica, do you want to mute this one sec?
Oh, sorry.
That's my ramble alert. So we have someone here called Suzette Woodward, who leads a social movement called Sign Up to Safety, who's been really influenced by Marshall Gantz's work. I think he probably gets along famously. But interestingly, the last time we were talking about social movements, she was talking about Al-Qaeda being a sort of a fantastic example, actually, of a social movement. And sometimes we like to akin talking about values and talking about movements and organising as a nice liberal thing associated with all things which are friendly to people who read The Guardian. Whereas actually some of those people who've managed to really harness the power of those principles are those who you might not necessarily agree with all of their views, but they have managed to do so in a really strong, in a really powerful way, with lessons for others in how you do that. Yeah,
and Helen Bevan with NHS Change Day, she used Marshall's framework, and I think I've heard of a few other people that are escaping me right now. It's so uncomfortable. People don't want to talk about themselves. In fact, we're trained not to, and especially within a patient encounter. So I believe that these techniques can be brought into how we communicate with patients in a very short period of time, and that bringing ourselves into the work is actually productive for motivating behavior. But it's not comfortable, as you said.
Right, let's not choose this as a jumping-off point to talk about Trump for the next 25 minutes. We'll go to Anna in just a second, but there's something you just dropped in, Jessica, when you were introducing, which I hadn't personally made the link at all, when you talked about psychological safety. People are starting to talk about that term, but probably not everyone on the line really knows what's meant when we talk about psychological safety. When you talk about psychological safety, what are you talking about, and what's the link here to joy?
Yeah, do you mind putting back up the framework slide that looks like a flower almost?
This one?
Yes. So when we're talking about psychological safety, we're talking about freedom from emotional harm, during your daily work, a belief that no one will be humiliated or punished for speaking up, a willingness to report errors and understand how they allow for organizational learning and improvement, principles of just culture used by all leaders, clear communication and feedback to team members escalating concerns, and then support services that are available to staff involved in patient harm. So those are kind of the key parts of psychological safety, and covers all different sorts of things. And there's peer support programs that can be learned from. There's how to handle disrespect and remediate disruptive behavior. There's safety reporting systems that feed into this, safety culture surveys, so many tools for this. Yeah, hopefully that answers your question.
Yeah, absolutely. And the link to joy here, very much being just linked to the conversation we had about how you can create that culture for people to want to open up and start to talk and listen.
Yeah, and it's also foundational. So it gets kind of back to that Maslow's hierarchy. You can't start to talk about commensality, which is the act of sharing a meal together and what it can produce for team outcomes. It's a fun thing to talk about when you're talking about joy. No one wants to hear that if they don't feel safe at work. You know, if you're afraid of your physical safety, you know, there's a lot of workforce injuries and violence and psychological safety. If those conditions aren't met, they're foundational. So you can't start to talk about others.
Jessica, thank you. And we'll come to you in a second, but actually we're going to use the link to, Danny, you've just actually written a blog all about that sort of the issues around a safety culture and learning from mistakes.
Yes.
Your perspective as you're not always stood here in the Kaleidoscope offices.
No, sometimes I'm at home working as well. Yeah. No, so my day job is actually as a trauma and orthopedic registrar, and the blog that I've written is about an experience that I had with a never event. So that's what we call them in the UK. It's when something happens, like a wrong site surgery or a wrong medication or a wrong dose of medication gets given. And very much, you know, sort of listening to what you're saying there, I was thinking, well, in health here, we're very tribal. And that's within hospitals, between teams, but also outside hospitals, between organizations as well. And there's not that psychological safety. So, you know, when I had a mistake, I didn't know what to do. I'd never heard anybody say that they'd ever made a mistake before in surgery. So you have the consultancy stand there and say, oh, my hip replacements never dislocate, or I never have complications. And we have a saying that is that the only surgeon without complications is the surgeon who's not operating. But as soon as I did have a problem, all of a sudden, a lot of people kind of came out of the woodwork and said, look, you know, it's happened to everyone. You know, these things that happen, sometimes it's out of your control. You know, when you look at a patient journey in the hospital, it's about 30 steps. They'll go through 30 different people before they go to an operating table. And it kind of, when it happened to me, there'd been something at every stage. And we talk about the Swiss cheese model. So the holes all align and the patient kind of falls through. So there is someone at the end of it who ultimately makes that mistake, but it's not you on your own. There's been a team effort, and it's been missed by everybody, not just yourself. And it was that kind of coming together that really helped me through that, because you kind of, when it happens, you want the ground to open up and swallow you, really. But there was enough people around me who gave me that support, who had been through it previously. And I kind of thought the reason I wrote the blog was because I thought, well, you know, this shouldn't be happening. You should know that there's that support there the whole time. So that's it. It's on the Kaleidoscope website if you want to have a read.
We'll put that.
Absolutely. I'm sorry for that too. That sounds really hard, and that culture of infallibility doesn't help, and no one talks about when things go wrong, and of course it does. And that's part of what IHI's work is to make it clear that these are systems issues, as you said, with the Swiss cheese model. There's really great work that I just wanted to mention coming out of Brigham and Women's Hospital. They do peer support. To get to your first point about tribalism, Jo Shapiro, she's an otolaryngologist by training, but she directs what they call the Center for Professionalism and Peer Support. So when there's been an adverse event, they've discovered that it actually is more helpful for for their organization, but she actually consults, which is why I'm mentioning this. She does a lot of traveling all over the world. That it's actually more effective for them to have physicians, counseling physicians, so that you're with your peers rather than in front of the care team that you're supposed to be leading, talking about what that's doing to you and what you're going through. And there's a lot of reasons for that. And talking about it and creating a system of support at an organizational level is so important. So she's a really great model. If you're sharing resources, definitely look up Brigham and Women's.
Lovely, Jessica. Thank you, and Danny. Thank you for sharing. Anna.
Yeah, just to say, I've just posted the link to Danny's blogs on the chat box there. But we have a question from Annalisa. Thank you, Annalisa, who asks, how do you sustain and maintain joy in the workplace, especially if or when the main enthusiasts move on?
Good question.
Yeah, I don't know the answer to that. I want to know the answer to that, and I don't. I mean, hopefully you've made changes to the system, right, that make the conditions and culture, they've made changes. But it depends so much on leadership behaviors. There should be systems in place so that you're hiring, right? You were talking about the whole journey for the patient. The same thing is true for the employees. There's everything from the onboarding to the exit interview are opportunities to improve the culture and to learn about joy in work and sustain things that are going on. So effort should be done at all of those stages. I'm trying to think about other mechanisms for scale and spread and sustainability. Is there something you want to share too?
I was going to say, I suppose a different way of phrasing it would be, how would you, if you wanted more joy at work, how would you take that to a leader? So, I don't have much joy at work and Rich is my boss. So how then do I get him to use your framework and things? It's not true. That's a hypothetical situation. We'll talk about it later. But, in that instance, what can you do as an individual?
To engage your direct manager in this work? So it depends on what their values are. It depends on what they're trying to achieve for the unit. And I would start by understanding their interests and having a conversation about your own. Not everyone is going to buy into this. And personally, so there's really great work out of Duke University. Brian Sexton does a lot on resilience and on the effects of gratitude in kind of making sure you as an individual feel joyful, that can help to sustain you. There are mechanisms for escalating these things if it's not getting through, but it's a challenge. I don't have a really great answer to that. It's very hard.
I disagree, actually. I think what you said at the beginning there was a great answer, that having people will go and ask their sort of system leader, what are your values, what are your interests? I'm thinking about this. I've seen this great piece of work by the IHI about joy at work and how we're going to implement that. Let's have a conversation, let's have a dialogue about it. And then asking about them. I don't think that's something that I would ever do. I don't know about you, but it's quite a personal thing, and it all comes down to that trust and that psychological safety that we've been talking about all that need.
And to pick up, I think that it's a really interesting point, and I think we touched on it a bit in the webinar on Tuesday, in terms of, you're talking about some fairly essential skills for surviving as a modern day medic or a modern day healthcare professional, about how you look after yourself and how you work as part of a team. I'm just really interested whether you've, as part of your work, have explored sort of the education and training we put our healthcare professionals through, whether there's a component missing there in terms of how individuals contribute to a joyful workplace, how they look after themselves, how they look after colleagues. Is that something you've thought about? Is that something which you can see happening or people starting to think about?
Yeah, such a great question. So my other hat is I work with our open school. So I work with our students. We have about 500,000 students involved with IHI's Open School. So this is our platform for online education. It teaches all of these topics in safety and quality and leadership, and it's free. It's completely free. And so the students have they take the courses, but they've also organized themselves into chapters, and they're doing really interesting work, like reforming the curriculum at their schools. And so they are trying to make changes that I think we really need to be thinking about. We need to be thinking upstream about our trainees and how our care team members are trained before they even get in, so that they have the mechanisms to not just support their own well-being, because we're hearing more and more about suicide, we're hearing more and more about burnout still in training and for our medical students, which is it's really devastating. So the earlier the better, and there's so many great resources out there for them, and the open schools one. So
check it out. Could I pass over, Anna? Do we have a question linked to that?
We have a question. Thank you, Gary, for this one. Gary asks, do good, effective leaders do this naturally? And how do you teach this for those who don't? Do they spread the joy?
Yeah, I think they do. What do you think? I do think it does seem, I'm thinking of Don Berwick, and he thinks it's just the most important thing that our staff be joyful. And it just, I really admire the leaders who really care about the people that work for them. There are obviously, I think we take it for granted. We think it's, you're either a good leader or you're not, or we think that it's really simple to, just assess people and then work on it. And actually there are so many skills that need to be taught in terms of leading teams and in communication and behaviors that promote this. Again, really great work out of Mayo supporting leadership behaviors. IHI has a free white paper, the High Impact Leadership Framework. That's a great tool. Mayo does have a leadership assessment for behaviors, which is available. We link to it in the white paper. It's also something we'll go through in the course. But a lot of times we find that like the organizational leaders are so remote from the work, or they assume that they know what's happening in daily work. And so the most joyful organizations, the team members can clearly communicate the direct connection between the organization's goals and their work. And that's because leaders have a presence with team members, and they link that mission to the daily work, and they communicate and articulate this during rounding or whatever. So yeah, it's critical.
Jessica, thanks. Daniel,
can I just flip things for a second? And say, we always think in health about the system, clinicians doing things to them, the patients. It's us doing things to them. But there's a book that Richard gave me very recently called Why We Revolt, and I don't know if you've come across this before. It's The Patient Revolution, which is an organisation started by Victor Montori, a diabetologist at the Mayo Clinic. There you go, Jessica's nodding now to come across him. And the interesting thing about his work is it tells stories, and it tells stories about how maybe the caring's gone out of healthcare. We've industrialized it so much, it's squeezing every pound to get the last bit of ounce of efficiency out of it. But that doesn't necessarily equal good and kind care and actually looking after the patient. It results in a treatment being given, but not necessarily that real, the strong care element that's disappeared. And the tactic that he's taking, it'd be interesting to know what you think about this, Jessica, but it's to actually empower the patients, because it's a shared decision. We talk about service, but actually it's one of the things where it's not us providing service for them, it's a shared decision. So he's sort of empowering patients with tools to take to their clinicians to say, this is how I want to make this decision. This is what my life is like, and this is how things happen for me. So, I would prefer this medication over this medication for, very, very valid reasons. It'd be interesting to know what your thoughts on that are, Jessica, sort of changing it the other way around.
Yeah, I had the pleasure of meeting Victor. We were at in Doha at the Hamad Medical Center, has a really incredible quality and safety effort going on. And he walked me through the cards as if I was one of his patients, and the decision-making tools, which are so incredible. It's really cool to see his work. I'm definitely going to check out the book. But joy is not gone from medicine. So one of the things that was so exciting to me when we did the second round of prototype testing and innovation work, and we were looking at other industries. We were going outside of healthcare to try to learn, because most of the great work around producing joyful workforces is not in healthcare. The one thing that we had that they don't is meaning and purpose. It's inherent. You can almost replace the word joy with service. People get satisfaction and meaning from this work because it's noble and it's meaningful and it's critical. And so that it should be celebrated. The work it's still really, really, it's there. The joy is there. The caring is there. And so all we have to do is get out of the way and let people do that. You're only statistically spending, I think it is about a third of your time actually delivering care, and the rest of the time is admin work, I think the studies have shown. So who's going to give you permission to use the rest of that time joyfully? It's got to be us. So I'm excited by the community we work in and just feel grateful to be a part of it.
Jessica, thank you very much indeed. One more question from me, and then I think we might start to move into closing reflections. If you've got any final questions you want to throw in, please do now. Jessica, it's been a fascinating conversation. What advice would you give an organisation which was, where do you start? What if they're starting from not a bad place, but a fairly average sort of place? They don't have a huge amount of time, they don't have much money, they're obviously going to sign up to the open school program, which why wouldn't you? But what are your top 2 things you'd say to someone if they were looking just to make some fairly small but practical changes to bring joy of work in?
Yeah, go to the bright spots. So I think our tendency is to do a needs assessment and start with where we're struggling. Go where the will is. You don't have a lot of time, but you might have a few individuals who have expressed an interest in doing something. Start there. Use your champions, help build their capacity or each other's capacity instead of trying to, fix the problem, because sometimes that can be demoralizing if you don't have a lot of time. The second thing, I don't know if this is like a top thing, but it just came to mind, is celebrate the wins. I was actually just talking to Simon Edgar in Scotland, and he was sharing with me some of the NHS improvement work and sharing how personal and private congratulations actually do result in behavior change, unlike certificates. And he talked about just like a box that an anesthesiologist had told him about that had thank you notes, so that people could write notes to someone else about what they did and who they are, and then they would be, she would take the box, email them privately, like directly to the person, and then collect them together and theme them, and that these then become some of the resilience assets that the organization has. And I just thought that was so cool. So yeah, celebrate the small wins, do it publicly and privately, and then also go where you have energy.
Jessica, thank you very much indeed. I'm going to turn to Danny, then Anna, then Jessica, just to get to one closing thought, if that's okay. But to buy you all time whilst you're all thinking, I will start off. And thanks again, Jessica, to a fascinating last 50 minutes. It's been a fantastic conversation. Thank you. And to cover such ground, joy, psychological safety, community organising, and beyond, it's been wonderful. I think the one thing which really stood out for me is how much we came back to listening, and actually whether this is the role of leaders or individual members of staff, but actually all of this starting from that genuine, I think if Kate and our team was here, she'd call it empathic curiosity, but genuinely wanting to understand what matters to others and genuinely being interested in the answer. And it seems like actually trying to make any progress in joy work without that foundational listening is going to be difficult. Danny.
So mine is something that Jessica said just a couple of minutes ago, was that actually we've got to remember in health we've got probably more capability for joy than a lot of other professions do, and we should always hold that with us, even when we're not feeling so joyful.
Thank you. Anna.
I was really struck, Jessica, by the figure that you shared initially about how it costs $1 million to replace a clinician working, and that just really shows, I think, or makes it stark, the cost of not creating joy in the workplace, and we need to consider that more.
Please start. Thank you. Jessica.
Thank you for letting me be a part of this. I learned a lot about that there's some really great questions out there, and there's a lot of thinking already being done, which we can build off of. So I'd love to continue to learn from and with you.
Excellent. Thank you very much. And I think we should say, as when pushed, Jessica, to give great examples of joy and work, pretty much the second place you mentioned was in London. So we're taking that as a personal win. Jessica, thank you very much indeed. Danny, thank you. Anna, thank you. Thanks to all those who have joined. This is the last of our 2 webinars, but we very much hope you're going to be with us for our all-day event on Joy in the NHS. Jessica, it's not too late to book your flights, which is on Monday. It is supposedly, so Monday, this coming Monday, is supposedly the unhappiest day of the year. It's Blue Monday. So we're looking to completely flip that on its head and spend a whole day talking about joy in work, how it can be promoted. So we very much hope you can join us for that. All of the information is available at kaleidoscope.healthcare/NHSjoy. We will leave you now, but thanks very much for joining.
Goodbye.
Thank you.
Thank you.